Okay, so this is a drill we want to be performing after we've done some opening of ankle dorsiflexion or anything that's going to messing with the sagittal plane of the ankle. So plantar flexion, dorsiflexion, that would be my foot going down or my foot going back up towards my face. So the range of motion is opened up, and now we want to use these ranges through its fullest available range of motion as I'm moving, okay? So the whole point of this is as I'm moving back, I want to make sure I'm contracting the tissues that would be shortening, which would be all the underside stuff and backside stuff here. As I'm bringing my knee forward, we want to shorten those tissues and give them some sort of effect. And that would be all the front side shin tissue and towards the top of your foot, okay? You put a timer on. We want to be doing this for roughly 60 to 90 seconds for about 2 to 3 reps. And then that would be complete in order to give us the signals that we need in order to make some sort of change. So let's start with the drill. I'm going to start from this back position. I'm going to scooch my body back a little bit out of frame, and I'm going to fully shorten and push my foot down on like a gas pedal through the ankle, not through the toes. And I'm going to feel this contraction on my gastrocnemius or my calf muscles as I'm pushing down. That's the fullest I can plantar flex right now. And then as I'm coming forward, I'm going to start to lift my ankle up towards my face and contract the front side of those tissues. And I'm going to go as deep as I physically can. Sometimes you'll feel a stretch on the back side of your ankle, and that's totally fine. Pause at that end range of motion, push down through my foot to start to get that contraction here. And then I keep holding that contraction. And then as I'm going, I might capture a little bit of a stretch sensation here, always staying away from painful range of motion. Cramping is common and normal. You'll start to get used to that as we go. Keep contracting the top side of that ankle. We're thinking bring the ankle up towards the face, not necessarily the toes. And then push down on the gas pedal over and over and over again. This is called kinetic stretching, where we're going to utilize all the tissues that are supposed to pull us into those ranges of motion versus trying to capture stretches passively. This is a very active drill, so it should get semi-fatiguing. This can be done on the floor as well. I prefer to do this elevated so I can push a little bit more of my weight into that dorsiflexion, which is where I'm most limited.